It's been a minute since I've been back up here walking on the campus where the hospital and such is. I actually feel like I haven't been here since I was done December 19th. That was almost 2 months ago. But I have to renew my CPR and AED certification. And if we're being honest, I truly believe that everyone needs to be certified in CPR and AED. It changes lives, it saves lives. And you do CPR if there's no pulse to try to circulate blood flow throughout the body. And AED is if there's no heart rhythm. So there would be an electrical current wave that goes to stimulate and hope to basically reactivate the heart. So yeah, saves lives until paramedics are on the scene or until a patient is able to be transported to the hospital. So yeah, I'm here to do that, and hopefully I can record a little bit while I'm there. Probably not as much. I've done this before. I think the last time I recertified was maybe sometime during my 3rd year. Yeah, time to do it again. Let's re-up, y'all. There were so many delays on my train, and if you're late for this, they're like, you're gonna have to pay a $50 fee. I don't have $50 free just to be given up to people. And so I'm literally like rushing to get there. I got 7 minutes to get there on time. I think I'll arrive in like 5, but I'm definitely about to arrive short of breath, a little tachypnic, if you will. And that is also going to encourage me to hit the gym later because this is out of order, just out of order. Y'all, that was like amazing. First of all, it was only me in the class, and this was the first time I'd say that, I mean, I always take it seriously, but she was like, oh, so where are you in your career? Like, are you a health professional? I was like, oh, I just finished medical school 2 months ago. And she was like, okay, Miss Doctor. I'm like, you right, Miss Doctor, that's me. I'm still not used to introducing myself as such because, what you mean? But background, I was a junior lifeguard since I was 13. Was the lifeguard from the age of 16 to 19. So I've been CPR and AED certified since like 13 or 14 years old. And just reviewing all of it, and as a physician, I know the importance of, life-saving techniques. And I stand by the fact that everyone needs to know how to perform CPR, and everyone needs to know how to work AED machine. But I'm about to go back outside, so we're gonna get into this when I get home a little bit later. So I am back home and I'm gonna eat a little snacky snack before I head out. Just some tuna, nothing too cray-cray, but I'm going to a coffee date with a friend from college. But that post med school haven't quite started being a doctor salary yet means coffee date means I will only get coffee and not a sandwich on the set. Okay. I guess I won't be eating and talking because that just took way too long to chew. All in all, CPR is a life-saving technique. Everybody needs to know how to perform adequate and appropriate CPR. If the individual is an adult, the ratio from chest compressions and rescue breathing, so breaths that you would give, whether it's via mask or mouth to mouth, is 30 compressions to 2 breaths. And you want to do that for 2 minutes. So that'll be about 5 cycles. And after 2 minutes, you should technically switch, because if you're pushing the correct depth, which is 2 inches, then you're going to be tired. Okay. And you should also be counting the compressions as well. Like, it's just a lot of work and effort goes into it. And then for AD, so this is exactly how it goes, right? You want to survey the scene. Okay, everything okay? You go up to the person. hello, hello, are you okay? Hello, can you hear me? Can you hear me? No response. Then you're gonna call out. Someone call 911, someone grab the AED, because you don't want to leave the person. But let's say it's only you, then I could take my phone out, and then I would just be like SIRI, because I don't want mine to go off right now. Call, 911, and they would do that, and then I would report everything to the medics. Like, look, I am out here, I see someone, they were unconscious, they were unresponsive, I'm calling you, and I'm now starting CPR, and I am alone. So I'm alone, I don't know where an AED machine is, and I thought that it'd be important for me to get on their chest to help with fluid circulation and air circulation. Hopefully they come, right? But if someone's there, you call out. And then you're gonna keep doing that. And once you put the AED machine on, it's going to tell you what to do. So first thing you do is turn it on. It'll tell you, okay, place the pads. One pad goes here over the right breast, and then one goes underneath the left breast. This one should be like kind of diagonal, and the other one is horizontal, because you're gonna see my hand. And then you follow the prompts. You continue CPR until it says to stand clear, or it's like analyzing heart rhythm. Do that. And excuse me, before you even start CPR, you want to check for breathing, and a pulse. So you check the carotid pulse. So you can start from the center and go to the side of the carotid. But me personally, I just go from here down, and I find the carotid artery, and you're going to tilt the chin up, and have your hand on the forehead and another on the chin. And you're having your ear next to the mouth and looking at the chest to see if it's rising from 5 to 10 seconds, while also checking for a pulse. If they don't have that, then that's when you begin CPR. Do that 30-2 ratio for 2 minutes. And for a child, an adolescent or child, what they consider that is from infancy all the way up to puberty. So that's a huge range. If it's an infant, you are going to do thrusts. Excuse me, for an adult, I didn't even show you how to do thrusts. So you have one hand like this, and the other one you're gonna lock it, and you're still palming. All of the thrusts are down like this. And so for infant, you're just going to palm and go like that. If it's one person, or if it's two, then you can grasp the infant and do chest thrusts like this. And the other person would then be delivering the rescue breaths. So for infant, one person is 30-2 ratio, same thing. And for two people, it's a 15-2. Chest compression is 15, rescue breaths 2. For a 2 on an adult, it's still 30-2. And if that child, that adolescent, is the size of an adult, you can still give thrusts as deep as 2 inches. On an infant, it should be like 1 inch to 1.25 inches. And on a child, up to 1.5 inches. Depending on body mass. So yeah, CPR saves lives. And if you are CPR trained, you should definitely hop in there if you're in a situation or you're around someone and you see that they need the CPR. We also talked about choking victims, and for infants, it is 1 breath every 3 seconds. Adults, 1 breath every 6 seconds. You also want to give stomach thrust. You would go above, find the belly button, go above it, and then thrusting on an upward angle, like a little diagonal. And essentially, you just want to thrust until you get something out. It's a partial obstruction or total obstruction. Partial, they can still talk. Total obstruction, complete obstruction, they're unable to talk. I just think that these are life-saving skills and techniques that everyone should definitely get. So if you are able to receive this, you can look into your local park district and see if they offer these types of trainings. And if you're in school, definitely please, please, please get it. I have never had to do this. Out of all the years of being CPR AD certified, I've never had to do it. But today, more than ever, I was super locked in, because I'm although I have not had to do these things while in medical school, by the grace of God, because I actually didn't want any super traumatic things to occur, because I knew the word is traumatizing, that I would be traumatized. And I just didn't want to experience that throughout medical school and all of the other trauma that was going on. But as a physician, I'm certain that at some point I'm going to have to do CPR on someone, going to have to shock someone, going to have to use AED, going to have to, give rescue breaths or whatever, going to have to deliver bad news to families. So I just took it a lot more serious, because to be asked oh, what are you? And I'm I just finished medical school 2 months ago. And they're oh, you're MD. And I'm I guess so. Yeah, I am. So just really leaning into my calling, leaning into my purpose, and leaning into my profession, my career, and knowing that all of the things I've done have really prepared me and propelled me to this point, and will continue to take me further. So yeah, that was today's highlights of finishing medical school and then what I was doing still medically related. So cheers. Let's eat some more tuna and watch Netflix before I head out. See y'all next time. Bye.